Welcome back to Plastic Surgery Untold, greatest podcast in the world. Super excited to have a little one-on-one session with Dr. Weinfeld, who has a facial passion, if you will. And let's talk about facelifts. But I think in the setting of the weight loss revolution, you were telling me offline that have really seen a little bit wider spectrum of face and neck lift patient population than maybe you would traditionally think. I think in the past we've thought about this being patients that are 60s, 70s, and that's really not been true for you in the recent past year or so.
Yes, this is an exciting topic, and that's a really important point. We used to think about a facelift as a procedure, really for 60, 70-year-old, and even for the mid to late 50-year-old. But I'm starting to see more and more patients who have very specific goals. And who really have done a lot of research and are just interested in having a facelift when they're in their 40s. I've always felt very comfortable doing facelifts on younger patients, but now I'm really starting to see a lot of patient-driven demand for this.
Don't you think there's a couple factors for this? One is obviously the weight loss revolution is having a profound effect of the number of people losing weight, but also I think some of the concept of facial beauty has changed. In the past, I think we were bridging people for a long time with overfilling the face.
Yes.
We're doing so many fillers and just doing this volume, and now people realize that maybe wasn't a great look. And I think we've talked about in other episodes, when we've talked about our med spa non-surgical stuff about the importance of skin tightening. While there's some absolutely phenomenal devices on the market, only to a point.
Yes. Yeah, these patients, they're looking for, and when I say these patients, I'm going to talk about the younger patient who has not lost a lot of weight. Some of these patients are looking for a very specific elevation of the cheek, really decreasing the nasolabial fold and the nasolabial crease below it. And they just know that the way that they're going to achieve what they want, the looks that they're seeing, in social media and their friends and magazines and TV is going to only be achieved. That sort of turn back the clock 10 to 15 years sort of effect with a facelift. Yeah.
And not just the cheek and nasal folds, but also the neck.
Absolutely.
Because there's some of the things that we've talked about, and we've talked about MyElevate, we've talked about RF microneedling, we've talked about jawline augmentation, but some of those things can't address some of the things that you do, especially with some of these deep plane facelifts where you're really addressing the entire musculature of the neck, because with the pure skin stuff, you can't really reset that muscle, also can't affect some of the salivary glands and other things that blunt some of that jawline appearance that people really desire.
Yeah, that's a really important point in that younger patients are presenting, and I'm talking about the non-weight loss ones, they're presenting and they're pointing out things that they're saying this is a familial trait or something I've always had. I've always looked heavy at their abnormal weight, and they just have a very obtuse, or meaning not very well-defined angle beneath their jawline, distinguishing their face from their neck. And there are factors that contribute to that are in the deeper plane, that are beneath the skin, beneath the thin layer of muscle. And that's excess fat, it's hypertrophied or enlarged muscle and enlarged glands. And all of those things can be addressed surgically through a relatively small incision beneath the chin, and then sometimes small incisions behind the ears, depending on if there is extra skin laxity there. So very powerful for these patients who just always felt like they looked heavy because they just don't have like kind of what they call a bull neck, where it's just full and you can't really see a definition between the face and the neck. Absolutely.
And on some of these patients, again, staying away from the weight loss, which we'll get into in just a minute, I've also seen you do some of these neck procedures in combination with chin augmentations and other things, because again, to your point, if you can't really get that framework, you're dealing with some congenital, some other things in these younger patients.
Absolutely. There are patients who are just born with very small jaws, small chins, or chins that are retruded. And, you can think of the jaw as something that's like a tent pole, kind of holding the tent up, really keeping it well defined and constructed. And if you have a very weak chin, you're never going to have enough support to really draw that skin out and have a very nice angle between the face and the neck. And so adding a small chin implant in combination with sculpting the neck surgically, as we discussed before, is a wonderful synergistic maneuver.
And then if we get into the weight loss patients, let's discuss that because that's super interesting because we've seen so many patients, 20s, 30s, 40s that have, been on their own weight loss journey. The majority of those on this 15 to 20, but you definitely have some 20, 30-year-olds that have lost 40, 50, 60 pounds. And there's just a limit to how much the skin's going to retract, even with all the non-surgical methods.
Yeah, with that deflation effect that wonderful weight loss brings about, we do see a different type of patient. So you have a young patient who now has the kind of excess skin that we used to see in our much older patients. And that's where that more full face and neck lift, where you're really repositioning the deeper structures, tightening the muscles, repositioning the muscles, where that's going to be important. But they're also going to need some of that skin excision, skin redraping, again, that not all younger patients need. It sort of puts it in the category of a facelift for an older patient.
And so what would you say, in terms of younger patients having face and neck lifts, how do you guide them whether, face and neck lift is their treatment or whether they should do soft wave, RF microneedling, some structural support in terms of filler stuff? How do you help guide someone that comes in? What should be a tipping point that they should really seek a face and neck lift?
Yeah, that I was talking, interestingly enough, I was talking to my wife about this yesterday. When I'm dealing with a younger patient, I almost want them to bring up the idea of the face and neck lift with me, whether they do it directly or indirectly. So here's a great example. If I have a patient who says, I just cannot live with this nasolabial crease, the heavy nasolabial fold, I've had filler there, I've done a variety of different skin tightening procedures, and I just can't get what I want. Can you make it look like this? Not everybody can. Yeah. Can I make it look like this? And what they're doing is they're pulling on their cheek, they're elevating their cheek. Then I say, yes, I can. But I think what you're showing me is that you're going to benefit from a face and a neck lift, or at least a facelift. And so I've let the patient wander into that because a facelift is it's a relatively involved procedure with an involved recovery. And while the scars are very difficult to see in the long run, there are scars that are on that outside portion of the face, towards the ears and around the hair. And so I want a patient to kind of get into that subject, breach that topic on their own, because they're already owning that decision, which is really important for patient satisfaction.
And don't you think that there's been a different mindset that has switched? Because in the past, we always thought of these facelifts being our parents' procedure, but really, patients are living longer. They're being super active. And I think there's been this overall mindset like, why do I want to wait to have a face and neck lift until I'm older? Why not doing it now while I'm living my best life and looking as fabulous as I feel? And I think some of the whole kind of weight loss journey of people being like, hey, I'm making a life change has led into a little bit of this mindset transition of, if this bothers me, why not do something about it?
Absolutely. And I think it goes hand in hand with the fact that in America and really in the world, plastic surgery, cosmetic surgery has really become part of just the everyday experience of people. It's no longer a dirty word. It's just part of our experience. People think of it as just taking power over their lives. And so, yes, of course, with those, with our weight loss patients who've lost a lot of weight, that's just the next step of empowerment.
What take-home messages would you want to leave some of our younger patients in terms of deciding whether a true surgical procedure is for them? And maybe even before you get to that, just so people understand, there's the full face and neck lift that you do for a lot of patients, but there's also a lot of other kind of spectrum of that in terms of endoscopic mid-face lift, endoscopic brow lift, other things that kind of fall in that realm that we consider face and neck lift, but may not be your true traditional full face and neck lift. That's the neck and around the ears and so forth like that.
Yeah, I would say that, so Pearl specifically for the younger patient is you got to think about, how long you're going to be away from activities, how long, do you feel like you have to recover, and then also what are you actually trying to achieve, and then what are you willing to do to get to that point of success? So as you said, if a patient is mostly interested in a little bit of cheek elevation, brow elevation, reducing the amount of skin around their eyelids, then you're going to be looking for the upper face with an extended brow lift, endoscopic brow lift, or even adding a cheek lift to that at an endoscopic subperiosteal plane. But if you're really looking for really significant elevation of the cheek and even some down into the neck, then it might be just a facelift, sort of a more traditional open incision facelift. And then if there's a lot of change that needs to occur in the neck, whether it be because of weight loss or just having a bulky neck to begin with, then it's going to be either an isolated neck lift or a neck lift in combination with that facelift.
Would you say that pictures of kind of like wish pictures like we do for breast, we do, for some of my lipo kind of tummy tuck patients, sometimes when I see a picture of what their goal is, it helps me push them one way or the other, because then I can be like, hey, the only thing that's going to get you to this type of goal is X. Is that helpful in the face and neck?
Oh, you know what? I'm going to say theoretically, yes, absolutely. And the reason I say theoretically is that I'm so familiar with using those for rhinoplasty. I mean, they are so important. But I've not had patients do that really yet for facelifts, or at least I can't remember that they have, or maybe not consistently, or this, younger population seeking a more of a traditional facelift, but I'm going to 100% encourage it now. I love that idea.
Because I just think, just like we've seen with the butt and other areas where there's just been such this massive transformation from, people just wanting to overly fill this, add a bunch of volume. And I just see with so many people kind of living their fit and fabulous life that you're going to see more and more of this trend of people turning towards skin tightening of the face and neck to really kind of give that chiseled structural appearance. And while I love soft wave RF microneedling, some of the structural support with the filler stuff, I think there's going to be some portion of patients that are really like, hey, this is the look I'm going for.
Yeah.
And if we don't address the muscles, the glands, the skin laxity, it's not going to get them to that goal.
No, yeah, there's only with regard to the filler, there's only so much lifting you can achieve with filler till you get to the tipping point of just looking overfilled, unnatural, as if you've gained weight, swollen, puffy, etc. Not that happens with everyone, but when used in excess to try to achieve something a filler can't achieve, that's where you need to consider surgery.
Well, Dr. Weinfeld, this has been super exciting, and I'm pretty sure we're going to have another follow-up with this in about 6 to 9 months, as we're going to see more and more of this and be able to answer some more questions about that. So super excited. Plastic Surgery Untold, greatest podcast in the world, is voted by us on iTunes, Spotify, or wherever you get your favorite podcasts. We'll see you guys soon. Bye.
Bye, guys.